take a look now at some of the other latest developments on the coronavirus outbreak around the world. Rescue efforts in China are continuing after the collapse of a 5-story building used as a coronavirus quarantine facility in the city of Qianzhou. At least 70 people were housed in the hotel. Not yet clear what caused the collapse. Local media say at least 43 people have been pulled from the rubble. There's been a sharp rise in the number of cases in Germany. More than 680 people now infected, 10 times the number recorded last week. No deaths have been reported. The World Health Organization says it's seen tremendous progress at hospitals across Iran in recent days. The WHO's representative says Iran has made facilities available in every province for the treatment of patients. Iran confirmed almost 6,000 coronavirus infections and 145 deaths. But experts fear the official numbers may be underestimated. Governments across the world are employing a wide array of strategies in order to try and tackle the outbreak. Virologist and host of the Naked Scientist podcast, Dr. Chris Smith, breaks down the stages of response we're seeing.
The containment phase, that's where if you don't have any evidence that an agent is circulating in a community or a geography, if there are new cases detected, you want to stop it going any further. And that's what containment means. And under those circumstances, you promptly identify the cases, you very quickly trace who their contacts are, so you can establish where they got it from and who they might have given it to. And the aim of doing that is to then stop it spreading any further. Now, at some point, there becomes a point where you say, well, look, there's clear evidence of spread, wider than just cases that are isolated and sprinkled across the community. So at that point, we're in the delay phase. And that's where you try as best as you can to slow down the rate at which the spread happens, but you acknowledge it's going to happen. And I think we're certainly in that situation, not just in this country, but in many countries worldwide. If you look at Italy, for example, the cases are rising there quite dramatically today. So we're certainly in this phase post-containment, possibly delay.
And what about the specific measures, though? Things like in Italy, and they're playing sporting events behind closed doors, asking people not to travel around, perhaps, unless it's emergency, things like that. Are these kind of the measures you expect to see in other countries now?
The thing about this virus is it's a new entity. We've not seen this virus circulate before, so we don't really know what it's going to do. We don't know what its behaviour is going to be. We're getting insights from places like Italy. We're getting insights from the data we've got from China, although that's a slightly different setup than, say, your average European country. So at the moment, it's a case of we look back in history and we ask, well, what have we done in the past for things like SARS, for things like flu outbreaks? What seems to work? And then take a proportionate approach. Now, Italy have said we're going to shut some of our schools, we're going to shut our universities. We're going to do that for a certain period of time, and they're hoping that's going to create the viral equivalent of a fire break, where basically you rob the virus of so many people it can infect, so you slow down the penetration through the population. But no one's kidding that this is going to stop it completely. It's not. It's still going to spread. It's still going to infect a large number of people ultimately, but you're slowing down the rate it can do that. Now, different countries have different geographies, different setups, different social systems, and therefore different measures that might work very well in one country aren't necessarily going to apply directly to another. So it's going to be a case of a case-by-case or country-by-country basis, I would say.
And what about things like panic buying? We've seen people in shops here in the UK go and try and stock up. Should we be doing that, not doing that?
No, I don't think that's a good idea. And it's not just the UK, actually. If anyone's feeling guilty right now, don't beat yourself up about it, because other people in other countries have reacted in an identical way. I was talking to a fellow journalist in New Zealand the other day when they announced their first case, and she said that supermarkets there were immediately denuded of all toilet paper. So there seems to be a common factor here. We seem to like panic buying toilet paper when we get into a situation like this. But no, that is probably not a sensible measure at the moment, because one way of looking at this is if we all rush to the supermarket and we all panic buy things, we're going to create a mass gathering in a supermarket. And that's exactly what the government are telling us not to do.
Finally, let's bring you some good news from China, where a baby who was diagnosed with coronavirus has been discharged from a hospital in Henan province. It's unusual for young children to contract the virus. The baby, who was diagnosed with Covid-19 just 5 days after birth, had been receiving treatment for the last month and has now finally been returned to his parents. They have also recovered from the virus and were discharged themselves 2 weeks earlier, along with another 4 members of the same family who were tested positive for the virus. Right, let me just give you a quick recap now of the latest events regarding the coronavirus, and focusing on Italy, where the major developments are at the moment. The government there is preparing to introduce radical new restrictions to contain the spread of the coronavirus, or at least attempt to. A draft decree published in the Italian media includes measures such as stopping all but emergency travel to the entire region of Lombardy. That's the worst hit area. It's the largest and richest of Italy's regions, with 10 million inhabitants, and includes the country's second biggest city, Milan. Identical restrictions would apply to 11 provinces elsewhere. The decree will also reportedly close museums, sports centres and ski resorts for several weeks. The head of the country's civil protection agency has said the defeat of the virus, Italians would have to change their way of life.